Why is adenoma removal important in colonoscopy? Imagine catching a tiny, harmless-looking growth before it turns into something much more serious. That's exactly what happens during a colonoscopy when adenomas are removed. Adenomas are small growths that develop on the inner lining of the colon or rectum. They are considered precancerous, meaning they have the potential to turn into colorectal cancer if left untreated. Removing these adenomas is a key step in preventing cancer from developing in the first place. During a colonoscopy, a doctor uses a flexible tube with a camera to look inside the entire colon and rectum. This allows the doctor to spot any abnormal growths, including adenomas. If adenomas are found, they can be removed immediately through a process called polypectomy, which involves snaring the polyp and cutting it off. This dual approach of detection and removal makes colonoscopy the most effective method for screening and preventing colorectal cancer. Research shows that removing adenomas during colonoscopy can significantly lower the risk of developing colorectal cancer. Studies, including the National Polyp Study, have found that patients who had adenomas removed are about 50% less likely to die from colorectal cancer than those who did not have their adenomas removed. This is because adenomas can grow and change over time, eventually becoming invasive cancer if not taken out early. Removing these growths interrupts that progression and keeps the colon healthier. After adenomas are removed, follow-up colonoscopies are important. They help monitor patients who are at higher risk, especially if they had large or multiple adenomas. Regular surveillance ensures that any new growths are caught early, further reducing the chance of cancer developing later on. For patients with low-risk adenomas, less frequent follow-up may be needed, which highlights how personalized care is essential. In summary, removing adenomas during colonoscopy is a vital part of colon health and cancer prevention. It helps catch precancerous lesions early, lowers the chance of developing colorectal cancer, and saves lives. This approach is supported by major health guidelines and remains a cornerstone of effective colorectal cancer screening. Always remember to discuss your individual risk and screening plan with your healthcare provider to stay proactive about your colon health.